Bottle feeding is a common practice for many parents. Whether using formula or expressed breast milk, there are instances where babies might choke during bottle feeding. This can be alarming for parents and caregivers. Why babies choke while bottle feeding? Number 1. Overfeeding or fast flow. The nipple on the bottle might have a flow rate that is too fast for the baby to handle, causing the milk to come out more quickly than the baby can swallow. Holding the bottle at too steep an angle can cause a rapid flow of milk, overwhelming the baby's ability to swallow. Number 2. Poor latch or sucking technique. If the baby does not take enough of the nipple and areola into their mouth, it can result in poor suction and control over the milk flow. Some babies may have weaker sucking reflexes, which can make it challenging for them to coordinate sucking, swallowing, and breathing. Number 3. Bottle feeding position. Feeding a baby while they are lying flat can increase the risk of milk entering the airway. If the baby's head is not properly supported, it can lead to difficulty in swallowing and increased risk of choking. Number 4. Distractions and environmental factors. A noisy or distracting environment can cause the baby to lose focus during feeding, which might lead to choking. Number 5. Medical conditions. Gastroesophageal reflux disease can cause milk to come back up the esophagus, leading to coughing and choking. Conditions such as colds or respiratory infections can cause congestion, making it difficult for babies to coordinate breathing and swallowing. Number 6. Milk consistency. The consistency of the milk can also affect the baby's ability to swallow safely. Thickened milk or formula might be harder for some babies to swallow, increasing the risk of choking. Prevention tips. Choose the right nipple. Use a nipple with an appropriate flow rate for your baby's age and feeding ability. Newborns generally require a slower flow nipple. Proper positioning. Hold your baby in an upright or semi-upright position during feeding. Ensure the head is stable and slightly elevated. Paced bottle feeding. Allow your baby to control the pace of feeding by pausing frequently and letting them take breaks as needed. Check for proper latch. Ensure your baby has a good latch on the nipple to facilitate effective sucking and swallowing. Monitor milk flow. Tilt the bottle just enough to keep the nipple full of milk, reducing the amount of air your baby swallows and preventing a too fast flow. Burp regularly. Burp your baby during and after feedings to release any swallowed air, reducing discomfort and the risk of choking. Choking during bottle feeding can be distressing, but understanding the reasons behind it can help you take preventive measures. If you continue to experience issues with choking during feeding, it's important to consult with a pediatrician to address any underlying problems and receive personalized guidance.